We're here with Dr. Emily Cooper with the Diabetes Research Foundation and author of The Metabolic Storm.
Dr. Cooper, in your book, The Metabolic Storm, you do talk a lot about this link between metabolism and infertility. So
yes.
Explain that.
Well, you wouldn't think that problems with the metabolism could really lead to infertility. But what people don't realize is that problems with metabolism are often due to the body either being starving due to lack of food supply or a perception of starvation that comes from a chemical imbalance. So the bottom line is either way, if your body thinks you're starving, it won't let you become pregnant. And right now in the US, fertility rates are at an all-time low.
But why is that?
Well, there are so many factors, but it's not only women who are affected because sperm counts too in males have dropped 50% in the last 4 decades. So that's why we're hearing so much about fertility right now.
So Americans are less fertile now for a variety of reasons, including environmental ones. What about more social ones like stress?
They all play a role. So genetics, you have to remember, genetics is a primary driver. Okay. So people who actually have family history of obesity or type 2 diabetes are particularly vulnerable because those diseases trigger metabolic issues. And there are lifestyle factors, increased stress, lack of sleep, dieting in our society is a huge potential trigger. But now we know too that endocrine disrupting chemicals in the environment play a significant role. And these are chemicals that are in everyday things that we're encountering every day. So household cleaning supplies, cosmetics, personal care products, fragrances, food packaging, pesticides, even the air we breathe. Wow. So they all do play a role.
So obviously that's a lot of stuff that you can't really control. What can you control if you are dealing with infertility?
It's a really good point. And you know, there's a lot of fertility clinics that are there to help, but the problem is they don't often search for the underlying cause. So if you don't find the underlying cause, even the fertility treatments can become unsuccessful or lead to problems for mom and child. So it's just really important to think that genetics, vulnerability, plus exposure to endocrine disrupting chemicals creates a perfect storm that can disrupt both your metabolism and your fertility. So it's important to be aware of your risks and to look around your environment. That's something you can change, and you can make sure that you eat all food groups every few hours so that you don't trigger that starvation perception, that you get plenty of sleep, that you avoid chemicals in the food supply and in your general environment. So that's a thing to do, and try to get to the root of it if you really feel that you do have a problem.
We were talking earlier and you said it begins in the womb. You know, we're talking about controlling your environment, especially for pregnant women. That seems to be very important.
Such a good point, and that really is alarming because studies are showing that women who have high levels of phthalates, which are often coming from cosmetics, and we're all guilty right now because we have the TV cosmetics, but the male offspring is shown to have potential reproductive issues, even as a child, plus also as an adult. So just due to the chemical exposure in the womb to the phthalates.
Okay, so bottom line,
pregnant women should really be aware.
Yeah, but bottom line, there are some things you can control.
Exactly.
Like you mentioned, the diet.
Yes, yes. Avoid diets, avoid cutting out food groups, avoid depriving yourself. And make sure you're fueling your exercise. You really shouldn't exercise if you're not fueling it, especially if you're trying to become pregnant.
All right. Dr. Cooper, thank you so much.
Thanks for having me.